I think she's muted.
She's an incredible woman. She's the CEO and founder of the Healthcare Standards Institute, but she's also was nominated the international chair of ISO, the Technical Committee 304 for Healthcare Organization Management. So she's an international liaison for creating healthcare organization management standards and reaching out to other nations, giving presentations for collaboration, working together. She also happens to be the owner and founder and CEO of one of the largest healthcare staffing agencies in all of North America. She's led organizations to Joint Commission accreditation, and she's a Malcolm Baldrige Fellow. And then just this year, she was voted into the Hall of Fame for the U.S. most powerful Latinas. So that was quite an accomplishment. So she's been in the top 10 so many years in a row. She's now a Hall of Famer. So I don't know if she should feel old about that or not, that she can already be a Hall of Famer. So myself, I'm a nurse by practice somewhat, and with a master's degree in global health. So I'm very passionate about population health and health strengthening throughout the world. I'm the director of strategic partnerships for the Technical Committee 304. So I also help build collaboration throughout the world. And the reason I got into this space is before I went into the world of healthcare, I was a consultant and a lead auditor for ISO 9000, which we know is the quality management system standard, the most used quality management system standard throughout the world. I now I'm the director of the whole audit program for the Healthcare Standards Institute. Can we all hear me okay?
Yes.
Okay, good. So alone, I really didn't know that our knowledge level of who all would be on the call today. So he asked me to start so we'll go wide and then we'll narrow down. So some of you might think this stuff in the beginning is super sexy, and others may think yan. And then others will think that the information toward the end is a lot more interesting to use. So just, what are standards? So some people call them guidelines, some people call them frameworks, principles, depending how passionate you are about what you want to do and what end of the spectrum you are, you can call them all sorts of things. But ISO says, think of it as a formula. So it's for the best way of doing something. So they're normally based on best practices, scientific evidence, and they're usually written by experts in the area of that subject matter. And some people may be interested experts as far as like an economic interest, and that's fine. Some may be more like me, just interested in making the world a better place. They might be sellers, buyers, customers. Many are trade associations, union laborers. So basically we call them stakeholders, right? In the world of business and organizational international work, we call them stakeholders. So examples of standards, they're everywhere, and we just totally take them for granted. So here are some rather obvious ones, like occupational health and safety. We have engineering, healthcare, electrical, but ones that I thought were really interesting. If you go looking, you can find a standard for almost anything. So there was one on how to make the perfect cup of tea, which I'm sure would be a little more interesting to our people maybe over in India or the UK. Mine would be how to pour the perfect cup of Diet Coke. But there's also ones for beer, and then the ever important, we take like maritime standards. We just take for granted the things that happen every day, that they're going to happen correctly and safely and that big barge is going to make it into port, and it's going to dump off all those things from that we ordered that are coming in from China. But we just don't think about all the standards and regulations that go into everything that is done from the time that barge starts to enter into port to the time that those things are offloaded and sent to each of us at our grocery store. So this is really a day to think about all that. So there's different, along with standards, everyone gets all confused. We have accreditation bodies, we have standards bodies, we have certification bodies. But as far as, there's all sorts of different organizations that create standards. So they can be private organizations, they can be public organizations, they can be private public partnerships. So I put some of the organizations up here that you might be familiar with. So BSI, British Standards, they do certification, but they also do help create thousands of standards. Then we have the Standards Organization of Nigeria. They do the same thing. The one that's probably best known throughout Europe and maybe even the world is the IEC, the International Electrotechnical Commission. They've been around, I think, since the early 1900s. There's Ghana Standards Authority. Underwriters Laboratory is a big one. The CEN is another mark that many people are familiar with. This one up here is from Algeria. There's the Joint Commission, which they have the Joint Commission. They started in the US for healthcare, but they actually have an international branch now. And then this AOAC International has to do with food safety. And they just entered into a memorandum of understanding with ARSO, which we know is the Standards Organization for Africa, to help increase and monitor food safety throughout Africa. So there's all sorts of organizations. There's thousands here that I haven't mentioned, including the two sponsors of the learning session today. But it can get complicated for sure. And then, between these organizations, we have shared responsibilities and partnerships. Some people don't want to share. Some people don't want to play in the same sandbox. Some people throw sand at each other. So I know that both of us on this call, we try to play in the sandbox nicely together. So why are standards so important? This is at the highest level of standardization. We know that, and I didn't put all the many statistical, the research and the data up here because we'd have screens full of data that we know that ultimately they lead to customer satisfaction and retention. And why is that? Because we're getting something right the first time, every time. So it costs 5 times as much to acquire a new customer than to retain an existing one. So let's say I'm a real stickler for when I call somewhere up on the phone, right? And if I get someone on the phone who doesn't know an organization, what, where to pass me to and who I'm looking for, and they put me on hold forever, or they send me to the wrong person, they don't have the information, then the likelihood of me personally using them again is very low. So, but if they have standards to which, okay, I'm supposed to say this, and now I'm supposed to do this, and now I know I have these options, that that I'm more likely to produce a positive customer experience. And I thought the data was interesting down here, that we live in a world now that it is so easy to share our feedback. It used to be very hard. It used to just be, telling your neighbor, right? And then they would tell someone and they would tell someone. But now 28% would post a negative review online. So I don't know how many of you are those online negative commenters, but 28% would do that. So I'm assuming that at least 20% of you on this call would do that. You might post it on your Facebook, right? You might tweet out something that someone did or put it on your Instagram. So it's really important that we get things right the first time, so we don't have to try to go back and get those customers. We know that standards increase safety. They reduce safety-related incident costs. So the loss of productivity when someone gets hurt on the job, and then they can no longer help in that process. So the productivity costs, litigation, the amount that organizations are paying when they're going to court or litigating against someone else's lawyers or the government, and then compensation costs, what they have to pay out when someone gets hurt. So that's not only in compensation to that individual for their future health and well-being, but also the cost, related costs for their medical their medical care. So the standards help us prevent safety incidents. And then the most important thing, right, is they save lives. So not only the consumer, but the workforce who's doing the work. So at one quote or statistic here is 1 in 20 patients are exposed to preventable harm in medical care. This is from 2019. So 12% of such cases result in permanent disability or death. So those are pretty outstanding numbers. And I can tell you, as of working in the healthcare field, I know this is true because we're humans and mistakes happen. But when we have guidelines and checklists and standards and processes that are established, we strongly reduce this. This over here, this picture, if you're not familiar with it, it's called lockout, tagout. And it's something that we do when people are doing preventive maintenance and electrical work to to machinery and equipment. So this saves about 166 deaths per year and thousands and thousands of work-related incidents. So someone just came up with this standard. We're going to put this tag on. It's going to do certain things. You have to get a key to open it, etc. So that's just one easy way to help save lives. And down here we have surgical checklists, which were incorporated and instigated some time ago, but really to go through and make sure you're doing those safety checks along the way when you're starting surgery. So standards in general, they produce higher quality products and services. Why? Because they're based on best practices, evidence-based practices, on research and data from industry experts, and they help us reduce uncertainty. So once again, we take these things for granted. I was thinking about this child in this car seat. So I would say that probably 80% of these components on this child car seat, because it is related to a child car seat, the end user, that the manufacturers making these products were held to establish standards for safety. So these plastic components, where the seatbelt snaps in, how high this headrest goes, the force against which this car seat, what it will withstand. And then not only do we have standards that govern how this is made, we in most countries there are standards for how to use this. So how long must this child be in this car seat? How tall must he be? How much must he weigh? Will we put this car seat facing backwards or forwards? So all these things are ruled by standards. And once again, we just take them for granted. We know that standards create a competitive advantage. Now, I know some people just want to grit their teeth and say, right, yeah, they just want to make us spend money, and it's not right. And, it's not fair that, they just get certified and someone just gave them that certification and we don't have that. And and we're losing business. But the reality is that they do create a competitive advantage. Let's talk about why. Well, for one thing, if we have the same product, same price or similar, right? And you're choosing as a supplier, this person is certified to a certain quality or safety standard. This person is not, or this organization is not. Which one are you going to choose? I mean, 9 times out of 10, you usually go for the one. If you have 2 equals, which one has put in this extra effort and has been recognized as achieving that certification? Another reason why they have a competitive advantage is many governments require certification or adherence to certain standards. So if you're working, for example, with US military, they will pass the standards down. Our suppliers must follow NIST specifications for screws or for rivets or for soldering processes. And I'm sure this is the same. Unfortunately, I can't speak specifically to different certain African nations, but I'm assuming it's the very same, that you must follow certain standards or you will not be awarded those contracts. So not only does the government require these, but many companies will pass these requirements down to their suppliers. So I know many companies that will say, we are ISO 9000 certified. So our suppliers must be as well. We're not going to go out and audit our suppliers all the time, and we're not going to deal with all that, but you must show us your certification to these standards. So once again, you have a competitive advantage. And they overcome technical trade barriers. The World Trade Organization is a very close stakeholder and a lot of communications with ISO, the International Organization for Standardization, and the OECD. And sometimes the World Health Organization gets involved, sometimes they don't. But they try to be a more of a neutral outside party. But all these organizations work together to decide what types of, how we're going to overcome trade barriers. And then finally, they facilitate a global language as far as trading with companies or dealing. Let's not even talk on a organizational level. Let's talk on an individual level. So if I'm choosing to go get my health care provided for, which more and more people are in other countries, right? Because it's cheaper, because I don't have insurance. So I can look on their website and I can say, oh, I can see they are accredited to Tamos International, this hospital for medical tourism, and they do these certain things. Well, I'm going to choose them probably over an organization that I don't know anything about as far as what type of standards they have in place. They also, standards help us increase operational efficiency and productivity. So what do I mean by this? Well, we have these documented processes in place to tell employees what to do and how. So they're not saying, okay, so what do I need to do next in this situation? So they're more efficient, they're faster, they're more productive. Error can be identified. So if we're doing the same thing the same way every time, we can identify errors, we can contain them and correct them. There's less downtime when we use standards and operating procedures, less rework time and rework costs, right? So when we think about rework, we have to think about not only are the work we're not getting done in the first place, we're thinking about the time that we had to identify that item that needed to be reworked, then the reworked containing of it, where we put it, and then the actual reworking of that. If there's any machine time involved in that, so there's machine downtime or machine time, maybe not down, but being used for other things. So there's all these different types of costs that go into not getting things right the first time. And there's whole courses on that and all sorts of formulas, but we're not going to go into all that detail right now. And so once again, if we're not doing something in a standardized process, we really have a hard time monitoring and measuring that. So that's why we do it. So I was thinking about this process right down here, this AirMed process. This is another thing we take for granted. I'm sure it's not the same in all countries, but I was an ER nurse in a trauma hospital, and um, this just looks so right. This is just done, right? We think that someone gets flight lifted somewhere, and these people run out, and this just happens. Well, that's not how it happens. And they're alerted on a system that's set up just for your healthcare responders out in the field. They alert this hospital through a highly sophisticated, well, depending where you are, system for emergency medical response. They answer in the hospital. They have standards in the hospitals, well, not even at the hospital, a central system to say, okay, these are the hospitals that are open. This is where you can send this individual. Then that ER gets contacted, and then they tell that ER, this is who's coming in, what type of medical, how long will we be there, estimated time of arrival, what situation are we looking at, et cetera. So these people who are running out here right now to pick up this person in need, they have gone through a very detailed process before they have even gotten there, and they monitor times of response times, et cetera. So we just want to, remember all these great things. And then finally, another reason why they're important, and this is just really up and coming, but I want you guys to really grab onto this and think about this, because this is the future of how the world is going. Years ago, we just talked about sustainable development and said, oh, that's nice, I'm going to recycle. But now it really is getting written into our standards and everything that we do. So when we're writing standards, and we really have the opportunity to make a conscious, calculated choice as to how we're going to do things so that we respect and utilize resources. So we know we have these United Nations Sustainable Development Goals, and we all want to say that our organization is doing something to help us achieve them. But in your standards, you could write, for example, okay, so with our rework, we have decided that we are, or with our, not let's say our rework, but the things that we're going to throw out, the metal that goes to scrap, we're going to make sure that this percentage is recycled, or this percentage is resold at a low price, or we are going to try to reduce carbon emissions by this much, and we're going to incorporate this standard to do that. Right now in the healthcare quality management, we are trying to say, we're going to use environmentally free chemicals for cleaning, or we're going to try to donate or resell medical equipment at low cost. So there are really things you can do in each area, but you have to make a conscious effort to write these into your procedures. So now that I've given a very quick overview of standards, now we're going to pivot into healthcare, which is at the heart of what many of us do and love. So for that, we're going to talk about, because it's what I know the best, we're going to talk about a certain ISO standards that are going on out there. Now, like I said, ISO is not the only organization that creates standards. There are many that do, and there are many that are just as good. It's just that ISO is an area that I work in and I know well. And I think it gives a kind of a good baseline for you to understand how standards are created, because we're going to talk about collaboration and how important that is. So ISO, which people say, why is it ISO? Because it's International Organization. Well, that's French, how it came out, ISO, but it's International Organization for Standardization. It's based in Geneva, Switzerland. It's independent, it's non-governmental, and it has 166 national standards bodies. So what are those? Those national standards bodies represent countries. So each country has one national standard body. However, not all countries have national standards bodies, and that's why there's 166, and I'll show you the ones that don't. So what ISO does is it brings together experts, and these experts do not get well, some of them get paid, some of them don't. It depends on how each country decides to set up their technical committees. But they're voluntary, they're consensus-based, market-relevant standards. So you have to be able to show there's a need for this standard. There's 250 technical committees. What does that mean? That means there are 250 specialized committees that are solely I'm thinking in Spanish, sorry, solely committed to developing standards and researching on a certain topic. So there may be one for rubber, there may be one for information technology. So we work on the one for healthcare organization management. So ISO has over 24,045 international standards. Their phrase is that they're a friendship among equals. And it really is like that. There's one vote per country. So it's not that, well, the United States or India, they have so many, their population is so big that they should get 100 votes, right? And Switzerland is small, so maybe they get 2 votes. And Nigeria may get 5 votes. No, it's one country, one vote on each standard. So all these countries come together, these member bodies, and like a symphony, they play together. This is what ISO says. ISO is the conductor. The countries are the orchestra, and then we make beautiful music. So these are the ISO member countries, which I think you'll find interesting. These are all over the world. So if you're gray, you are not a member country, which there's very few. And then there's subscribing members and corresponding members. And that just is a different level of participation. But this is where they are. Specifically, now we're going to talk about the ISO Committee for Healthcare Organization Management, Technical Committee 304. So these are, it's actually very sad to me because I think this is probably one of so we're a newer committee, only been around for, I think, about 3 or 4 years, which is for a technical committee, it's a baby new one, but it's probably right now one of the most needed technical committees that we have. So we are exploding, but for right now, these are our members. In Africa, you can see it's Ghana, the Democratic Republic of Congo, DRC, Uganda, and Kenya. So thank you if you're from one of those countries on the phone. And then over here, you can see we have our more Northeast Africa ones. We have Egypt, Tunisia, and then we have Senegal over here. Now, these are observing members, which means they can comment on things, but they can't vote. So we would love for these O members to become P members for sure. So now I'm gonna, I'm not used to giving a presentation and not letting you guys give feedback. So I feel in your mind, you're asking questions, and I feel bad that I can't stop, but we will not finish. So let me keep going here. So we're gonna kind of let you know about some of the standards that are currently underdeveloped in our technical committee, which these are super exciting. So to kind of show you how these get made and who they're coming from. So we have one that came up for pandemic response. And of course, this one came out quickly. It's a group of standards that came out quickly after COVID started around 2019. And our convener is South Korea. So South Korea is a member of the technical committee. And the standards that are falling under that big umbrella is drive-through screening stations. So drive-through testing right here. Walk-through, so standards for walk-through screening stations, temporary medical facilities. This one's really important. So, when COVID first came out, everyone was starting to, how do we set up these big tents, right? And treat people for COVID, and how do we isolate them and segregate them? And what is the flow? I saw all these different setups that I would go for disaster response. So these are standards on how to set those up. COVID will probably not be the first or last, or we know it's not the first, but the last pandemic that we have. So this will be used later on for other things. And then they have a standard for self-symptom tracking. You can see the work group leader is also, so you have a convener, a work group leader. Sometimes they're the same, sometimes they're different. So this is South Korea on both of these. And you can also see where the experts are from right here. They could be from any of those countries that has an ISO TC 304, but these are the ones that are currently active. So another one, this is really our gold star, our big, an up-and-coming standard that we're hoping will be adopted the worldwide. This one was based on ISO 9000, Quality Management System Standard, but it was adapted by a really impressive, strong group of experts. From some of them are WHO consultants. A lot of them are from our liaison member, ISQA, the International Society for Quality in Healthcare. People from ministries of health, we have one from Malawi, Ministry of Health, people from all different major organizations throughout the world, public and private, adapting ISO 9000 quality to the healthcare setting. It will be a game changer if it is adapted worldwide like we hope. It just went through its first draft. Actually today, it came out of ballot and commenting. So we'll be incorporating those changes and then sending it out again for voting. So look forward to that, maybe coming out in mid-2020. Hand hygiene, another one that was started years ago, but a couple years ago, but just recently, wow, we really need this. So this is not just how to wash your hands. So it has to do with water safety, water cleanliness, everything that's involved with the hand hygiene process. And this is our convener is the US, but we're really, really excited that Hungary is the work group leader. Sorry, the convener is the US, work group leader is Hungary. So very excited about that because it's so important to get other countries really taking the lead in this, in the writing of these standards. Vaccine management. So this one was another one that came out as a result of COVID, but we know that there are standards, those of you who work in these type of things, for cold chain and logistics about vaccines, how they're delivered, how they're given, how they're stored. But this would be an ISO standard based on the feedback from experts throughout the world. So vaccine management is one you can get involved in, and that was coming out of Poland. So also super thrilled about that. And then the other one that's going to be a really big deal that I'm excited about is telehealth. And that one came from an idea actually out of India. And the convener is the US, the work group leader is open, meaning that any country can come forward that has a TC 304, and they can put someone forward to be the work group leader. And then we're really, another thing we're super excited about is that our secretariat is coming out of Ghana. And this is their first time to take a major lead role in one of our TC 304 standards. The only reason I say under vote is everything from ISO is done by a vote. The vote will most probably be yes, but we always have to vote on everything because that's what we do. So another, just I wanted to let you guys all know that one that is out right now that just came out in June, I believe, or late June, early July, is patient-centered staffing. So ISO 22956. And this really has to do with having a patient focus on how we do our staffing. So an enhanced patient experience, how we can improve our compliance with regulatory and professional requirements, improving staffing outcomes. So better recruitment, how do we deal with staffing shortages and gaps? How do we make sure we have the right skill mix in our staffing to help meet those patient needs? It leads to reduction in your staffing fatigue and your burnout and sickness. So we have improved job satisfaction. And we know when people are happy, they're working, that they have improved the way that they improved work, that their outcomes are better in their work. And then as a patient level, these patients will see greater visibility of staff, better quality of service, and improved outcomes as far as falls and safety and medical errors, because we have the right staffing mix with the right to our patient ratio. All right, I'm going to go a little quick on the end because we started just a little late, but things that I want you guys to really think about that are coming out, and we're calling them hot topics that we've identified in our technical committee, where we're really going to need some standardization. There's this, this has been throughout time. We always find that, of course, regulations lag behind innovation. So standardization lags, and we see this right now more than now than ever in things like Facebook. All these problems because their technology went way faster than regulation, right? And now we're going, oh no, I think we need to put some stops in here. So some areas, artificial intelligence in healthcare. There's so much going on, but you know, we can look at chatbots, we can look at robots, cobots, genomics, but we really need to stop and think, are we getting the right data? Are we controlling the data that we're getting? Are these robots interacting with our patients as they should be? And our patients understanding how to interact with this data or this robot that is talking to me? Things like that. So that's an area for standardization where we're really gonna need people to step forward and come up with best practices. Another thing is everyone's doing these wearable health monitoring devices, whether these have to do with diabetes or cardiac monitoring devices, or even data that we're getting from things like Fitbits. There's a big argument about there, like what is considered medical. And it differs throughout the world. But if people are using these to make making medical decisions, like, well, it says that my blood pressure is normal, when really your blood pressure is 200 over 110, you know, who is accountable there? So there really is a lack of regulation and standardization in these areas. And as healthcare monitoring becomes more and more at a distance and more wearable, this is going to be very important that regulation keeps up to speed with innovation. And then we have this huge area of healthcare data mining. So there's all this data out there, and there's all different ways that they're getting it, like web mining. So off of the World Wide Web, everything that's out there, or they can do it on language processing. They can look at text mining. We're using predictive modeling. There's all these different approaches out there to get this health data, but you know, how do we know everyone's coding their data the same? You know, and how do we know that there's interoperability between systems and the data and really what we're doing that it can be put into functional form? So a lot going on out there. And then, you know, the big one that that is the big, you know, the elephant in the room right now is new ways to approach healthcare workforce shortages. So we have an aging population, meaning people are living much longer. So we need more healthcare workers. We also have a healthcare workforce that is older throughout the world. I think it's over 50% of Italy's healthcare workforce is over the age of, I think it's 55 or 65, somewhere around there. So people are going to be retiring, and we're going to have to figure out ways to deal with this. And this doesn't even take into account countries that already have major workforce shortages just due to not having the people that are educated and available to be able to do this type of work. So I think through creative standardization and best practices, we can also start to deal with these workforce shortages. My part was very fast, and I'm sorry because I know that English isn't always everyone's first language, and I'm an American speaking quickly. So now I'm going to send this back over to Veronica, Dr. Edwards, the chair for ISO TC 304, and she's going to give you a call for action because this is one thing she does so greatly. Back to you, Dr. Edwards.
So thank you, Angela. The most important thing from here is to really understand that this is also a call to action to be involved with us. We need you, we need your countries, and we feel that on behalf of the Technical Committee 304 for Healthcare Organization Management, no matter what we do, it's only going to be successful if we can get 100% participation from the countries around the world. So please, what we'd like to ask is you find someone within your organization, reach out to your country's national standards body to become a subject matter expert or a liaison if you're not part of the national standards body. If you don't know who and where to call, because sometimes it can be a little bit of a matrix to maneuver through, you can feel free to reach out to us. We will provide that information. And of course, the team on the call today can also direct you. We can give you those points of contact and actually work alongside you to have that participation to the next level. So this is really a call to action. The standards are under development, and there's more that we haven't even talked about. I am right now looking for someone to convene and be part of a strategic relationship and a new potential standard for suicide management. It's something that's actually coming around the world that's very, very important. And as Angela covered earlier, we have a telehealth project that's already been approved and the working group has established, but we are looking for a subject matter expert to serve as the project leader. And again, if you or someone within your organization is interested, please let us know. Next slide, Angela. I want to leave this because I think some of you may be associated, aligned with a university and or just have an amazing way to communicate. We do have and sponsor the official publication for the Healthcare Standards Institute, which is the Journal of Healthcare Management Standards. There is a published website out there for a call for paper. We're providing it here. And we have two types of thought leadership that we are soliciting. First is a position paper. What is your position on any given topic? It can be 2 to 3 pages, obviously with some citations. It does go through a voting process and whatnot. Our editor-in-chief is from Harvard University. And then of course, the second segregated call for papers is for manuscripts, traditional manuscripts within the scope of healthcare organization management, and specifically standards that you think would be good standards, or why, what your vision is for the future. So I'll leave you with this. Angela, next slide. I'll leave you with this. In certain countries, once an ISO standard is published, it becomes their regulation, it becomes their law. And so if you're not interested in a standard, know that what we're doing is important to developing countries, to develop countries, so we can start working together to expedite treatment in a quality manner for other patients. And frankly, everybody on this call, including myself, at one time or another, and we don't want to admit it, but we are or will be at some point a patient. So we're doing this to help us all. If you're not sure and you do want to become participants, one of the most common questions I get is, how much time is this going to take? So know that the time is really something that we tell everybody, get ready for about 2 to 4 hours a month. So it's not a huge ask. If for some reason you are unable to attend or participate, everything in ISO world is posted on our portals. all the work, all the documents, any of the notes that come through, advanced notifications for meetings are posted for everyone to see and have access to them, and if you need to, translate. So it does make it easy if you miss a meeting or two to go and get caught up. So I'll leave you with that and just encourage each of you to find time to be involved in some way. Visibility onto the portal and the documents that we are creating is limited to only those countries that are participating or observing or liaison organizations. So in other words, you have to officially join. There is no fee to join the TC 304, but please, we'll defer to you, to your national standards body or your organization, so you can gather more information on what the your national requirements may be. So on that note, I want to thank everybody again for joining us and open up for questions if you've got any, whether it's in the chat or otherwise.
Wow, thank you very much. Thank you, Angela and Veronica. This is great. Thank you. So please, if you have any questions, any comments, any contribution, you can raise your hand and then you can ask. You unmute and ask, or you use the chat box. Any question, any comment you would like to make? They've got some few minutes more with us, so. Hello.
Why people are thinking, I don't know, do you have a, I don't know if with registration you have people's emails, but if they need a way to get involved, I can type something in the chat box right now, or they can contact you, or how would you like to do that?
Yeah, so we have their email addresses in the registration. So at the end of this, we can share the presentations with them. Yes. So
okay, excellent.
Yeah. Any questions, any comments, any contribution? I think because I am healthcare biased, one of the standards I saw was a surgical safety checklist. And my curiosity is to ask for those in healthcare who are on the platform, how many of our surgical departments are using the checklist, for instance, if you can share? Or how many of our countries or our institutions are using any standards? Might not necessarily be ISO, but any standards that you are using in your institution as well, if you can share. Thank you. Yeah, so you can all get the presentation or the slides. I'm seeing people, because not everybody joined. There are over 100 people registered, and only a few of you, only about a third of you are on the call. So if you can type in your email address, then we can send it to you personally. Thank you. But otherwise, if anyone would like to share their use of the surgical safety checklist or any checklist or any standard in their facility, that would be great. You can unmute and speak if you want to.
I would like to add that the standards that we develop within healthcare organization management do not include the clinical delivery of care. This is basically the layer of standards that healthcare administrators or the management layer would use within a healthcare entity.
Okay. That's great. Thanks.
Oh, I see that in Kenya, they say that they use it, but enforcing it, oh, that is a challenge. And then the one from the WHO, that's great. There's a couple who use it in yeah. Who?
Great. So yeah. Okay. So this is Dr. Stanley. Unmute and Go ahead. Stanley from Kenya.
Thank you, Elom and Angela. It's been a great session listening to all of you. Yes, for sure, when I saw the surgical safety checklist shared there, I quickly was impressed, and I had to type that, yes, this is one great tool that after invention easily brought down the complication rate and the mortality rate from surgery. Atul Gawande, one of the founding teams, usually likes to say that there is no other miracle drug that has been discovered since the discovery of penicillin that has reduced the mortality and complication rates from surgical infections. Now, a few years back, we had an issue of patient misidentification in one of the leading referral hospitals in the country. And at that point, then you go back and realize the checklist was there, but reinforcing the use of the checklist was actually the weak link that brought the question, that brought the problem. So what you realize is there is folder upon folder of standards and SOPs, but getting them reinforced consistently becomes the issue. And perhaps as we think from those of us who might be in health regulation and health reinforcement, maybe insurance reimbursement should be tweaked towards ensuring that hospitals have consistent output of their quality measures, including how they adhere to standards of safety that are recognized worldwide and used worldwide and locally, because they are there, but really no one looked at them at that point in time. And we know when we interrogate the systems that we might be causing more harm than good for the patients who come to the hospital, just because perhaps we did not pause for that second and use that checklist that we already have developed. Yes, that was my comment. Thank you. Back to you, Elom.
Thank you very much, Stanley. Thank you. Thank you very much. All right. So any other comments, any other contribution in any of the countries? We've seen Kenya. No, there is Nigeria on the call, there is Ghana on the call. Other countries that did not. Any other contribution?
So has anyone on the call ever been, I'm curious, involved in writing a standard? Or procedures, or gone through that process of having to try to agree with a bunch of people?
Hello.
They're quiet today.
Yeah. So I get, Waja, do you want to say anything?
Yes, we have been part of the accreditation process of when we are doing a COSASA and even BSI. Some of the procedures, we are the one who raise them and control them in our facility for the government or for the private sector. So we do that. But I think this was an informative training to help us open our eyes in a broader way, in a broader scope, to understand more about ISO standards in general. Thank you.
Oh, okay, thank
Because
you.
most of the hospitals, the government ones are going through COSASA, but the private mostly they use BSI.
Oh,
Thank
okay.
you.
Okay, thank you.
I can't see where to put up my hands. My name is Ajibike Oyewumi.
Okay, please go ahead.
I am from Nigeria. I've worked with the Society for Quality in Healthcare in Nigeria to develop a set of standards for healthcare facilities. And those standards were accredited by ISQA.
Oh, great.
In February of 2020. So right now we're in the process of sensitizing and getting those standards out. We finally did our first, what we call a practicum. So we got a hospital, one of the government hospitals, to ask us to come in and do a baseline assessment of their organization using it. Of course, during the process of development, we piloted the standards in both private hospitals, small size, medium size, and in a government hospital. We went through, of course, first of all, we went through the process of trying to put the standards together, a team, a technical committee, and then we had several stakeholders review. We had stakeholders review in person, so subject matter experts. And then we had the town hall meetings where we had, I think we had almost 75 people from across the healthcare sector. We had government representatives from the government. We had patient representatives. We had the healthcare professionals, doctors, nurses, laboratory pharmacists, radiologists. We had, we tried to be as wide as possible, and we got them into the room for one day and broke up the standards, asked people to volunteer to review wherever they wanted to. Prior to that, we had sent those standards out to them so that they could read, prepare to be involved in commenting. And so they came together and we used the Roomba principles to say, is this relevant? Do you understand it? Is it measurable? Do you think it's beneficial, and is it achievable? And, so they reviewed the standards. In addition, we also asked for volunteers, threw it open to as many people as possible in the healthcare field to say, do you think this can work in Nigeria? Because these will be the first set of healthcare standards that are being published in Nigeria. That way, especially one that would be internationally accredited. So yeah, we're very proud that we got those standards. They're available now. We also developed a guideline. So we have a guidebook because most professionals in Nigeria are not used to those standards. We developed a guidebook that tells you, helps to explain what the standards mean and what you can do to meet the standards. So we have that as well. Yeah, but I know several hospitals. So the hospital I used to work with, I was quality director in that hospital for a while, has been GCI accredited, got the first GCI accreditation in Sub-Saharan Africa, 2011, and has been reaccredited 3 times. And I've worked with a couple of other hospitals that are COSASA accredited or Safe Care certified is the word. So I mean, that's landscape of what I understand is going on in Nigeria at the moment.
Wow, that's some huge accomplishments. Congratulations. That's a lot of work. And yeah, and I know we all get, you said something that's interesting, we all get confused between accreditation and certification. In the most broad terms, normally, like you were saying, there's someone accredits a body to certify, but there can be all sorts of different layers of people saying it. Some people use them interchangeably. Some places are certified, some places are accredited. It seems like the laboratories use accreditation more. It just kind of is somewhat interchangeable, but just kind of depends where you are. Great.
Yeah. Thank you.
Thank you. Any other? I see Sierra Leone, Dr. Shuwari. Any experience from Sierra Leone you would like to share? I think we've done Kenya, Nigeria. You can just unmute, or any other person from Sierra Leone who would like to share. And there is Kathy. Kathy, who said it's here. Yeah. Is anyone speaking? Kindly go ahead. Okay, there is Kathy who said was involved with the development of the COSASA standard. So any experiences and lessons and how that has gone as far as outcomes are concerned that you would like to share?
Hi, good evening, everybody. Thank you very much for a very interesting presentation. Yes, I'm Kathy Duddy. I was the Standard Development Coordinator at CASASA for 4 years, and now I'm their Professional Development Coordinator. Our standards have gone through quite a rigorous re-accreditation process with IHQSA now, and we've consolidated them into one suite of standards so that they cover all healthcare facilities. I think the approach we took was that there's certain core functions that happen at every facility, regardless of whether it's a clinic or a hospital, things like management and leadership, quality improvement, infection control, those sort of things. So we have a set of core or generic standards, and then we have standards for ambulatory care now and standards for inpatient care. And those were accredited by IHQSA in 2018 and due for re-accreditation now in 2022. So I think for those of you who are looking to get standards IHQSA accredited, just a little tip, it's not just the standards. There's a lot of work that goes into the functions, the monitoring, the data collection, proving that you've involved a lot of role players in your standard development. It's a big job. And I'm very impressed to hear that people are doing it. So congratulations, and thanks for, again, a very informative webinar.
Thank you, Kathy. Thank you.
Yeah.
Any?
So one thing, you know, I just want to share that I think is really important. I know that a lot of the stuff that I'm trying to get the screen big, that we all do has a business aspect to it. Let's be real, right? But, you know, I think we've kind of found, especially more during this COVID time and everything, that, you know, it's our goal at ISO to, we really want to work together with all these organizations that do this work. So whether it's IHQSA or whether it's, you know, in South Africa, or whether it's a Canadian accreditation, you know, bureau, or whoever it is, I don't feel like this is like there's not enough room in the swimming pool. You know, we're in an ocean, you know, and so I think, you know, that we should be sharing. And I think that, you know, ISO, you have to remember, you probably don't know this. Most people don't understand. ISO does not accredit and they do not certify. They don't do any of that. They just create a standard and then it stops. So there's all these great opportunities out there for people to accredit and certify to any standards that they want. So just remember that. You know, I just want everyone to feel welcome to the party, because the party's big enough for everybody.
Definitely. Welcome to the party. Yes, I see somebody. Does anyone wants to speak or add on? Otherwise, we should be ending any moment from now. I think I saw one of my friends join, Sonny. I'm sure he's okay. So if there is no other comment or question, I don't know whether Gilbert is still on. Gilbert, any thoughts and any comments?
Yes, I'm here and I'm listening to all the discussions. Just a second. And all the questions. First, let me thank Angela for the presentation. And I think for us, the real issue is all that, as she said, are critical. We've heard of it, we know of it. And I think getting the question is, what actually are we going to do? What will we take out of this? As I said initially at the beginning, for me, I would want us to, each of us actually, just choose one thing inside the presentation, just one. Follow up either with your institution, follow up with us, follow up with Angela, have a more in-depth or deeper dive into the area. We meet 1 year from now, you say, when I came for this webinar, I chose to do this and I have done it and this is the result. Let us not just be in the process of We come, we listen, we go, and we add it to knowledge. I think the biggest challenge that we face is translating all of these into actual practice. And that is where that's what I'm sitting with as I listen to the presentation from Angela, as I listen to the dimensions and perspectives that came on board. And even with the questions that people have asked and the contributions made, you know, my excitement in being on the webinar was to make sure that we can start doing. We can start doing, even if it's just one standard. Let's work on it. You know, let us be the advocates for management and leadership to be comfortable to being accountable for quality. And that's what standards are. They are intimidating by default. They are very intimidating by default, where you have to measure yourself up to a standard. That is in itself intimidating. Can we be the advocates to make it a way of life? Let it be the proper thing to do. So those are my insights, those are my sharings, and that's what I want to contribute to the webinar. Over. Thank you.
Thank you. Thank you very much, Gilbert. So I don't know, Angela, any last words, any last insights?
Yeah, just that I totally agree with Gilbert. I always think about, you know, we tend to have a lot of knowledge, but we don't have a lot of translation. So we have it to have it, but we don't act, because the acting is the hard part, right? It usually is, you know. So yeah, I just encourage you all to not take this stuff for granted and get involved, because it's quite rewarding. In fact, the world needs you. So thank you. Thanks for listening, and thank you for your time.
Thank you. Thank you all very much. So the recordings will be available on the AfIHQSA YouTube channel. You just Google AfIHQSA, you will have the recordings. The unedited recordings will be there. We have shared our email addresses as well. So those of you who have shared your email addresses, we will share the presentations or the slides with you just after during the week. So thank you all for joining, and let us go and make a difference. Angela, thank you very much. You and Veronica. It's been very exciting, very grateful. Thank you.
Thank you very much.
Well,
you guys,
happy World Standards Day to all of us.
Happy World Standards Day.
Sure.
Bye, world.
Sure.
Bye.
Bye. Thank you.
Bye.
Great. Good.